All right, this morning I'm going to be talking about chronic fatigue syndrome or CFS. Why it isn't going? Um, Chronic fatigue syndrome is characterized by debilitating fatigue that is not relieved with rest and is often associated with physical symptoms. Debilitating fatigue would be anything from joint and muscle pain, to loss of concentration, to unrefreshing sleep. You'd have like headaches, sore throats, your lymph nodes would be enlarged in your throat and your armpits. Um, but it causes not only physical limitations, but mental issues become more apparent as you're going through it. As you can see, depression is apparent in 39 to 47% of individuals who have CFS. Um, just in America, around 2 million people have it, most of them being undiagnosed. If you're a woman, you're twice as likely to get it. Um, and people over the age of 40 are more likely to develop it than that of a younger age. Um, Chronic fatigue syndrome is still a complex disease, and it's still under debate to see if one thing exactly causes it. Now they're kind of speculating many different things can affect it, like your genetics, your immune system, your sleep and nutrition, your adrenal system, and this thing called the biopsychosocial model, which lacks evidence to be proven, but many physicians believe chronic fatigue syndrome is purely somatic, so it'd be yourself kind of making it worse in your head. Like one bad thing leads to another, which ends up leading to another, so you think you can't win. With your adrenal system, you have lower levels of cortisol. Um, you also experience impaired adrenal cortex responsiveness, so you'd be a little slowed down. With your nutrition, you just see lower levels of omega 3 and omega 6 fatty acids, along with lower levels of zinc. Um, Same thing kind of goes towards sleep. They're just day nighttime rhythm would be messed up. So, like, when it gets dark out and you normally get tired, they wouldn't exactly be getting tired. But for sleep and nutrition, you see that supplementation doesn't really fix any of the problems that it's caused. Um, your immune system, like everything else, with this, it says that the Epstein-Barr viral infection could end up being a cause for CFS, but it's still like, again, mixed evidence showing that. Um, with your genes, like it's kind of self-explanatory. There is a mutation that occurs with your metabolism and immune response, um, but it's not like the sole cause, like a bunch of things could end up causing it, not just your genetics. Um, so for the diagnosis, there's two different types, the Oxford and CDC. Most of them are pretty similar. The Oxford just looks at like a little bit more of the mental part of it than rather than just the physical. But with the CDC, you need severe fatigue lasting for over 6 months and at least four of the following symptoms: that muscle multi-joint pain without swelling, headache of a new type, pattern, severity, your unrefreshing sleep, your short-term concentration gets messed up, um, post-exertional malaise for over 24 hours. That just means the symptoms of fatigue don't really get any better. They kind of just they just don't get better. Um, then you also have those tender lymph nodes, but that's just for the CDC. With Oxford, again, it's looking at more of the mental part. So your primary symptom would be, again, fatigue with definite onset of another system, like your fatigue affecting your mental and physical function. So that could be tied to the impairment of short-term concentration. Your symptoms lasting over the 6 months and are there over 50% of the time. Other symptoms must include myalgia, mood, and sleep disturbances, but you would want to make sure to exclude those established with medical diseases known to cause CFS, like that Epstein-Barr viral infection. And then there's other diagnoses you could get, which you'd want to exclude people diagnosed with schizophrenia, manic depressive illness, substance abuse, or a proven organic brain disease. Um, Chronic fatigue syndromes, exercise response. This one's a little tough because they could react differently. So, as you could assume, you get fatigued after exercise. So, it may worsen some people's symptoms without benefiting it, but others may actually greatly benefit from this. To understand it, like, you have to know that CFS can be categorized into mild, moderate, or severe. Um, Mild ranging from they can still do stuff to severe being they're pretty much stuck in their bed and someone has to help them do everything. Um, so again, the medical option is still divided on whether individuals should engage in regular exercise or not, just kind of because it could end up setting them back even longer in the long run. Um, but there are certain ways to exercise, like with cognitive behavior therapy or graded exercise therapy, or both. The cognitive therapy helps to alleviate like the depression and anxiety the person may be feeling. Um, and then the exercise therapy, of course, helps to improve strength and endurance without fatiguing them as much when they get done. And that emphasizes the importance of pacing the individual, which allows them to gradually build the strength to complete their exercise rather than like pushing them past their comfort zone and trying to expedite the process. But it improves things like fatigue. Well, I guess your fatigue after completing the exercises, your work life, because like you saw before, if you're in bed most of the time, you can't really go to work. Same thing with social adjustment. If you're stuck in your house, you're not really going out, you're missing your child's uh, life moments, which can lead to things like anxiety and depression, which will also get better if you begin exercising. Um, and then again, with the recovery from exercising and the post exertional malaise, that even gets better just by going through the exercises and doing everything. Um, in response to other medication, there's not really a specific cure, but there are other medications that can help, like limit the symptoms. Most being over the counter medications, which just help relieve your headaches, muscle and joint soreness, things like aspirin, ibuprofen. And like the only really thing that you have to watch for with these is their blood thinners, so you kind of wouldn't want to do it before coming into the practice to complete your exercise, or even if you're going outside. Um, but then it gets into like prescribed medication, which generally a practitioner has to prescribe to you, and it's normally just for a short period of time. Anything ranging from like antidepressants to muscle relaxants to sleeping medication, even anti-seizure medication, which all these things kind of have a response to exercise. Antidepressants, um, other than that one, they don't really affect your exercise other than they could like lower your mood, make you not want to exercise. The muscle relaxants would increase your heart rate and blood pressure at rest and at exercise. The sleeping medication will slow or depress your body functions at rest and during exercise, so you'd be moving a little more slow, making it a little more difficult. And then, of course, it is important to modify it since they can't really do a whole lot of exercising without being in pain. Um, so you'd want to implement like starting with shorter bouts of exercise, maybe working up to 10 minutes because they might only be able to do it for a minute or so. Um, we know that vigorous intensity can help other illnesses, but it definitely should be avoided with chronic fatigue syndrome because of the post exertional malaise and just their bodies can't really handle the recovery process of it. They'll end up hurting themselves more than helping. And then with other chronic illnesses, you might want to try and push them past their comfortable limit because it ends up benefiting them more than hurting. But with people with chronic fatigue syndrome, you kind of want to keep them right in their limit. because it could cause their conditions to flare up due to overtraining. Um, and then this one's probably pretty easy to figure out. It's important to emphasize rest and before so you can kind of allow their body to prepare themselves for what they're going to have to do, and it'll give them time to recover after putting that stress on their body after being mostly sedentary. Then for my case study, there's this woman, Judy, who is 52 years old and has mild chronic fatigue syndrome. She's mostly homebound, but makes it outside to walk around her yard a few times before starting to feel muscle weakness and joint pain. She was prescribed cyclobenzaprine and zolpidem, zolpidem, to help her with her muscle aches and sleeping troubles. She was cleared by a general physician to try out exercising under professional's care. She just said she just wants to go outside for longer and with less restrictions after she's done moving around. So of course you'd want to talk to her and get like her ECG, what her symptoms really are, like if it's just muscle and soreness. Clearly it's affecting her sleep if she's taking zolpidem, and the muscle aches with cyclobenzaprine, so you'd want to talk to her about that. She already gave you her goals, so then you could kind of get into the prescription. With aerobic activity, you'd want to do like 2 to 3 days a week with a rest day in between. For their intensity, on a good day where they're not having a lot of symptoms, you'd want to have them do like a graded exercise test, figure out their target heart rate, and then you want to stay within 2 to 3 beats per minute of that target heart rate every time they come in. For time, I said 8 minutes of continuous exercise, symptom dependent, because if they're coming in without feeling good, they're not going to be able to do the 8 minutes of continuous, so they only might be able to do 5 minutes one day. For the type, I just said continue her to walk around her yard, or even if someone's with her, she could end up going to a trail. Then that gets you into flexibility. For this, I said 2 days a week, making sure they're not back to back. Again, emphasizing the rest day. For intensity, I said stretch the feeling of tightness, but make sure not to stretch too far past, because that would then kind of be pushing them and could cause their symptoms to flare up. For time, I said hold each stretch for 10 seconds and repeat 30 times. And then I just said normally static because I thought ballistic would be too much for them with fatigue, and PNF I thought would be kind of hard to do by yourself. But resistance training is normally avoided because it puts too much stress on them, and it's normally replaced with that graded exercise training, which is called GET. Other forms of gentle GET people normally recommend are like yoga, warm water exercises, and this thing called like Qigong, which is like the Chinese's oldest form of medication. And then that's it.